Yes. Hmm. Yeah, going live. Yeah. Okay. Okay. Hello. I'm Dr. Nagamani from Hyderabad, Raghava Hospital. I'm a gynecologist and a obstetrician, and I've been doing this for the past 30 years. I run a hospital by name Raghava Hospital, in which I do the obstetrics and gynecology practice, and I do infertility, laparoscopy, and ultrasound scanning also. And today I'm talking a bit about this back pain in pregnancy and the postpartum period. See, the back pain is a very common problem which is experienced by about 50% of the people in pregnancy. Back pain in pregnancy, there are multiple reasons are there. One thing is that as the person is increasing in weight very fast, sometimes more than 1 kg per a month, and as the abdomen is protruding to the front, and the back to maintain the center of gravity in the center, the back starts bending to the forward. And because of that, lot of strain is being put on the back, and it causes back pain. And in addition to that, because of the hormones, there will be some laxity in immobile joints also, which will cause pain when the patient is turning to one side and other side, and in the sitting and standing posture also. See, all these things, in addition to the nutritional deficiency, they can cause back pain in pregnancy. And because of this, sometimes because of some urinary infections, for some people because of the pre-existing back pain, all these things will contribute to the back pain in pregnancy. So what is the solution for this? One thing is the weight gain in pregnancy should not be excessive. It should be about 750 to 1 kg per month. And when the person is standing or in this thing, they can use some supportive system which will support the belly aspect and as well as the back. So these things, to some extent, they will reduce the strain on the back. And when the person is lying down, they should use a proper type of bed. And if they are lying on the back, they can fold their legs and use pillows under the leg. Bend the leg at right angle at the knee and use pillows under the leg to support the back. And if they are lying on a side, bend the upper leg slightly and put a pillow in between the knees to support the back. In addition, there are some long pillows are available on net which can put wherever the support is required. This is one thing. If the person is having by any chance any urinary infection, they can think about the urinary culture and clear the infection. In some cases, this will clear the back pain to some extent. And postpartum period, that is after delivery, when the abdominal belly suddenly becomes flat, the back which has bent for about 9 months towards front side, it cannot come back to normal in such a fast fashion. In those cases, that's why the strain will be put on the back. In addition to that, most of the people they stop taking all the vitamins and other things once the delivery is over. That it also causes pain. So what should be done? One thing they should take proper calcium and vitamin D. The second thing is they should take iron at least for about 3 months. Third thing, they should wear a belt and which will support the back. Whenever they are feeding a child, they should sit to the wall, see that their back is straight, lift the baby when feeding by putting some pillows, and that way they can avoid back pain. And during pregnancy, exercise will help them to relieve the back pain. There are some specific exercises are there, which if you see I cannot, if possible, I put the photos in this, or else you can search in the net. So all those exercises which can be done during pregnancy, you can do it. And taking proper vitamins and other things, and taking proper amount of calcium will help. In addition to these things, some amount of massage on the back and acupuncture, sometimes physiotherapy, these things will help to reduce the back pain. For some cases where there is a very severe degree of back pain is there, orthopedician help where they can inject some steroids into the front symphysis pubis or into the sacroiliac joint. Such a things may be required for some people. Now, Navir Kapoor has asked, does walking strengthen your back? Walking will definitely help for the back muscles to become strong, and that is definitely advisable for a person with a normal pregnancy. Only some people where there are some other complications are there where the rest is required, it is not advised. Otherwise, it is a good thing. Hmm. Reena Kumari has asked that if she sits and her back is causing some type of pain. So it is, I do not know what is her weight and what is her stage of pregnancy, if she delivered or post delivery, but whatever is the condition, they first get her back checked if she is delivered already by an X ray. Any bony problem is there, let her get them clear. If there is nothing, then this taking calcium, vitamin D, and doing a proper back exercise if she is pregnant, that will help her for this thing. Lakshmi Mishra has asked, how do you strengthen your lower back muscles? See, there are some specific exercises are there. If these exercises which can be done in pregnancy, so those will strengthen the lower back muscles and to some extent relieve their back pain. If she is post to delivery cases, then she can do all these yoga exercises which will strengthen her back muscles. And some exercises are which are there in the net. If you search, they are there. If possible, I'll put the photos, and otherwise you can just search in the net. How should I sleep with the back pain? Lakshman Mishra has asked her. If she's having back pain, as I said earlier, if she's sleeping on the back, she can fold her legs, put pillows under the feet, under the leg, or if she's sleeping on the side, she can fold the upper leg and put a pillow in between the knees. What is the best vitamin for back pain? Lakshmi Mishra has asked again. You see, any vitamin that is vitamin D and calcium should be taken, but that alone is not enough. Enough for poor back exercises are a must. Nevax Kapoor has asked, can pregnancy cause long-term back pain problem? See, if there is a pre-existing lumbar pain which is there before pregnancy, that can persist or worsen after the delivery. If it is only caused during pregnancy, by reducing weight, by doing proper exercise and other things, the back pain will be relieved. And at the same time, these cesarean section, epidural or spinal anesthesia will never cause back pain. Many people who have back pain, normal delivery people also will have equal number of back pain. So many that misnomer is not correct. She has asked, how do you recover back pain? One thing is reduce your weight, do proper back exercise, adjust your posture when feeding, see that you sit straight. These things, and when you wear a proper lumbar belt for some time, do proper exercise. Bhavani Anandpat has asked what home remedy is good for back pain. Home remedy is back massage and anything like small exercise, other things. Revati Rajamani has asked how do we get rid of post-pregnancy back pain? To reduce the post-pregnancy back pain, if you do not have a pre-existing back pain before pregnancy, then after delivery, as I said right now, reduce your weight, sit properly when feeding the child, and use proper calcium and vitamin D dosage. See that you are not anemic and do exercise. Sonam Patel Sonam Patel has asked, why does my back hurt postpartum? As I said, because of sudden change of center of gravity and while feeding the child sitting in a wrong posture, bending too much to the front, not taking vitamin D and calcium, these things will cause back pain. Poonam Sharma Poonam Sharma has asked, ma'am, I am 25 weeks pregnant. If I sleep straight, my back becomes stiff. How should I sleep sides only? I think, as I said, if you can sleep on the straight but fold your legs, if you are sleeping to the side, fold the upper leg. Rebecca Prakash has asked, how long does it take for the postpartum pain to go away? It all depends on our effort and how we do it. Durga Salvi has asked, can pregnancy cause long-term back problems? See, it is not like that. If there is no pre-existing problem, whatever problems have come, they can be tackled in a proper fashion by what they said, by reducing your weight, by using calcium and vitamin D, by doing proper physical exercise, and some yoga also. Rachel has asked, Doctor, any tips for good posture? See, posture in what sense? If you are feeding your child, you sit, putting your back to the wall and use pillows to lift the baby and then do feed the child. If you are walking, see that like a model walks, you see that your back is straight while walking. And if at all any pain is there, for a short period, use a lumbar bed, short period only. Lumbar bed. This and regular walking will keep your back straight. She has asked any special sitting position. Special sitting position if your back pain is in the upper part of the back, then you have to fold your legs putting a stool under your feet. That will reduce the pain. If your back pain is the lower side, then in that case you should not bend too much and not sit for a long time. Whenever the pain comes, you should take some rest. She has asked any tips for normal delivery. That is, see, it is a broad term. You can do a proper walking to keep the pelvic muscles in a relaxed fashion, and you can do some in the yogasana. There is a asana is there that you can be done, and a squatting position. All these things will relax the pelvic muscles. But whatever bony pelvis is there, nothing can be done. That will be like that based on the delivery will happen. Why does my back hurt after having a baby? Andrea Kitten has asked. See, when you are lifting a baby, your bending posture, the strength of your back, all those things will cause the pain. So while lifting the baby, also like what you are lifting a weight, you should take proper precautions when sit and then lift the baby and do something to strengthen your back. That will relieve the pain. Andrea Kitten has asked, can pregnancy cause long-term back problems? Like what I said, it is not a permanent this thing. Our effort will completely relieve whatever back pain comes. during pregnancy. Andrea Kitten has asked, can carrying a baby cause back pain? See, if you are not maintaining a proper posture and if your back muscles are weak, if your calcium levels are deficient, if you have a pre-existing back pain, then back pain can persist. But if it is coming during pregnancy, by doing proper back strengthening exercises and diet and calcium, that will go off. Himanshi Sonawale has asked, all the best dear moms to be. I don't know what she wants to ask. Um, yes. See, the back pain, many people they eat a lot during pregnancy. Actually, 400 calories is enough for a pregnant lady to for the extra need what they require. If we eat excessive and not doing a proper walking, minimum exercise is walking, and the weight increase will cause more back pain. If you have a pre-existing low back pain, get an orthopedic consultation before you become pregnant, and any precautions are necessary. You take those precautions accordingly. And many people are afraid to do physical exercises during pregnancy, but that is not true. See, some exercises which can be done during pregnancy can be done, and if you do it, your back will have less pain, and whatever small pain has come, it will go and it will be more relaxed. And these exercises, to some extent, they will help you to have a pelvic muscle relaxation, which is to some extent can cause an obstruction, or rigid pelvis can cause difficult delivery. So those exercises, if you go to the net, they are available. Do not be afraid to do exercises if you are a normal person and if you are not advised to bed rest. So these exercises will help you to relieve your back pain. Do it. Especially after delivery, many people will think if you eat this, if you eat that, something will be caused to the baby and other things, and they stop taking all nutritious food. That is not correct. They should take the proper calcium throughout their lactation period, and for the first 1 to 2 months or 3 months, iron to regain whatever blood they have lost. So these things, they will help for the normal strengthening of the bone. And in addition to that, because of caring for the baby, many people they don't even go for a walk, leave alone exercise. That is also not, and at least if you can put your baby in the pram and then go for a walk along with the baby, that will be good. Otherwise, at least take half an hour out of your baby's time. Do not devote total time to the baby. Look after yourself. Do proper exercise for about half an hour, yoga exercise, aerobic exercise, or some exercise which will be there in the dog position. So many things are going to do in the neck. Do them, your back pain will come down. And to whatever extra gain which you have gained after delivery, those things particularly that should come down. If the weight comes down, the strain what is put on the back also will come down, and the back pains will come down a lot. Spinal anesthesia or epidural anesthesia, many people will attribute to that, but their back pain to this anesthesia aspect. That is not correct. And nowadays, the anesthesia is given with a very fine needle, a needle size with which we give injections to the newborn babies. So many, if you compare the number of people having normal delivery, number of people having the cesarean section, equal number of both people will have back pain. That is not related to the anesthesia, but the amount of care or not caring about their back is the cause for the back pain. That is the case. Rachel has asked the back pain is temporary. Back pain which is not pre-existing, that means which is not there before pregnancy, that is only temporary, and that can be cleared like what I said by following all those 1, 2, 3, 4 steps. The back pain will come down. Preeti Chauhan has asked, कैसे ये बैक पेन ठीक ठीक होगा डॉक्टर? Back pain, reduce your weight, use calcium and vitamin D, do proper walking and back exercises, Surya Namaskar in yoga. So all after delivery these things. If you do it, the pain will come down. You should not sit idle. You should take care of yourself. Rachel has asked any add-on supplements to be taken for strong bones. Vitamin D, calcium supplementation, vitamin K2, and magnesium. All those things is will strengthen the back. And to some extent, L-carnitine also will help for the reducing the pain. Rachel has asked pain last after delivery for how long? How long is see after delivery you should use a back supporting belt. Then like what I said right now, use all the things that are necessary, and if you how much of effort you put based on that the pain will go out. Rachel has asked is back pain sign of miscarriage? No, it is not like that. It can be of multiple reasons. Rachel has asked pain lost after delivery for her. I think I have answered this. What can be done for more leg and thigh strengthening? That is it during pregnancy or after delivery? You are asking. If it is after delivery, for thigh strengthening, this lifting first, sitting in a chair, lifting your legs for how long you can keep the legs straight in the air is one first exercise. Second thing is you can hang some weight half kg like that at your ankle and lift the weight along with that. That will also strengthen this thing. Cycling will strengthen your thigh muscles and this thing. Walking, jogging, all those things will strengthen the thigh muscles. Rachel has asked, when should I worry about my back pain in pregnancy? See, if the back pain is persisting along with abdominal pain, lower abdominal pain, and if there is some weight like pulling like feeling is there into the vagina, if it is associated with a lot of white discharge or a watery type of discharge, if so all those things, if such a type of thing is there, then you should consult your gynecologist to see whether it is a sign of a premature labor. After examining, they can tell you, or is it a sign of some urinary infection. So that will clear the doubt. Thank you for your compliment. See, my referral code is Purna. I am available for consultation on BabyChakra. If anybody requires my help for consultation, they are free to contact me. One thing is during the pregnancy, do not take that as an abnormal thing. Limit your weight to 750 to 1 kg per month. Take proper proteinaceous diet for the nutrition. Do not take excessive unnecessary calories. Do proper walking is a minimum exercise. In addition to that, if you can do exercises, that will be still better. And only some medical conditions where they will be advising a bed rest. Otherwise, doing their keeping an active life is always better during pregnancy. That will cause the relief of pelvic muscles and bodily and mental health also in a proper fashion. That will be good for them.